thank you for staying with us until now. We are slowly approaching the end of the day, but not yet, because we still have to talk a little bit more about chemicals, which is a very important topic, and sustainable procurement. And we have Anders coming back on stage for this.
Yes. Well, I'm back. I think that's because we in HCWH we move away from single-use speakers to reusable speakers. That's the new ambition. So I represent one of them. It's late in the afternoon and we start to get tired. Please stand up. All rise, as I say in court. Just for a second. Move your legs and... sorry. I look a bit more awake. Okay, ready for some more chemicals. Now you look tired. Okay. Okay, please sit down. You can stand up if you want to, but it's feel a bit awkward. I will speak about chemicals and procurement and try to wrap up things and refer to previous talks and hopefully give you some advice or some tips for what to do next when you come home. Some of these slides I have shown several times in different conferences, so maybe you recognize some of them. What have we learned? That's what I'm speaking about. University of Jutland is here. It's the west coast of Sweden. We are actually the biggest region in Sweden, but we are 21 regions where we have lots of chemicals. We have 17 hospitals, 200 primary care facilities, 170, 80 something dental care, so we have lots of chemicals. We also have the opera house, museums, public transport, and things like that. And 21 regions in Sweden, which means that we cannot work in silos if we want to have a toxic-free healthcare. So for some years ago, we initiated a network called the National Substitution Group. And the idea was to share good examples between each other. So that was the start. And also, how can we harmonize our procurement criteria? And what was very obvious regarding, especially chemicals, but what you buy is what you have to deal with. Once it's in the hospital, it's there, you have to deal with it. So the procurement or purchase, that's the gatekeeper. And after you have bought things, you have to store them, and you use them, you have to do risk assessments, and you have to dispose them or phase out. And what we very early realized was if you do something wrong in the first step, you have to live with that shit all the way through. It could mean that it could have environmental impact, health impact, and also economical impact. If you have to buy special storage facilities for explosive chemicals and things like that, or you have to have expensive PPEs, or people get injured by using these chemicals, or they are expensive to dispose. So it has three impacts. And again, like this morning, price and cost is not the same thing. A very cheap thing over there could be very expensive in the long run. Speaking about chemicals, I'm going to speak about two kind of categories of chemicals: disinfectants, biocides, and cleaning chemicals, and then maintaining chemicals. I used to call them the forgotten chemicals. I'm going to show you why in a moment. Cleaning and disinfection is not the same thing, as you probably know. If you disinfect something, you kill the microbes. If you clean something, you remove the dirt. If you have a surface that should be disinfected, you have to clean it first and then disinfect. If you buy disinfectants, they should, of course, kill the germs. That's why you use them. But you have low occupational impact, occupational health impact, low environmental impact, but also a reasonable price. And you can receive that by procurement. Of course. This is a bit slow, isn't it? One question that we asked very early was, why do we have perfume in these products? It should smell good, but why? I mean, perfume is actually a problem. It could have environmental problems and also cause problems with your skin. If you should use less gloves, you should be cautious by washing your hands. Then you should be really skin-friendly soap. And not something containing a nice fragrance, smelling nice. But some of these fragrance, they could be from flowers, from plants. And then they claim it contains natural perfume. And if something is natural, it's potential allergenic. So a natural fragrance does not mean that it's good. So we actually said, no, we ban perfume. And the suppliers said, what? What's this? Nowadays, after some years, they don't even offer fragrance, cleaning chemicals or soap or disinfectants. Everything is fragrance-free. Regarding biocides and disinfectants, we use alcohol-based disinfectants, more or less everywhere. Preferentially ethanol instead of isopropanol. The reason is that this is more hazardous to occupational health. It smells bad and it could be troublesome. Sometimes we have to use it because ethanol is quite kind of angry to plastics, like incubators for small infants. They get foggy by ethanol. We have started using hydrogen peroxide instead of chlorine. So chlorine is more or less phased out these days. It works well. And one thing that we also noticed when we did our procurements, we asked for the list of ingredients, not just the safety data sheet. Because the safety data sheet does not tell you the whole story. So if you want to avoid certain chemicals, we have to make sure that it's not in there. And nowadays we also ask for the purpose of the ingredients. Is it a detergent? Is it something for stabilizing the pH? Or what is it? We thought that should be a problem for the suppliers. No. Okay, they're confidential. We don't spread the news. But they replied to it. That was no problem. Oops. And then we said, we don't want sprays. No aerosols. Both for disinfectants and cleaning chemicals, because you inhale these small aerosols, and that's not good. And no perfume in disinfectants, and no allergenic preservatives. That you can see if you ask for the list of ingredients. No PHMB and quaternary ammonium compounds, very common, but they can actually induce antibiotic resistance. And also antimicrobial coating. That's something we're really cautious about. If we buy things, we don't want this nano silver coating. This is a really good tool. I hate this website. It's Upphandlingsmyndigheten. I told them it's totally impossible in another language, Swedish, that you can click on that link, you can find really nice criteria and advice for how to set up criteria when you buy chemicals or other things. It's really good. I want them to have another name, but they refuse, unfortunately. It's in English and Swedish. You can just choose. So I recommend to have a look at that. And ask for third-party labeling when it's possible. Cosmetics and also cleaning chemicals. If you ask for that in the procurement, then they have already done the evaluation. We just procured cleaning chemicals for vehicles like cars, helicopters or boats, all kind of things. And most of these chemical products were actually Nordic Swan labeled. So there's a movement by the suppliers to move towards this third-party labeling. And follow the hygiene routines. Wash your hands carefully with soap and water, skin-friendly soap, no perfume, and use hand sanitizers. Make sure that you buy hand sanitizers that delubricate the skin, because water is one of the worst chemicals we have, actually, because if you wash your hands over and over again, you get dry hands and dry skin. And at least in Sweden, when it's cold in the winter time, make sure you wear gloves when you bicycle to work, not gloves like this, I mean like warmer ones. And also when you go for lunch or when you leave the hospital, lubricate your hands. Because if you get these wounds on your hand and you're a surgeon or a nurse in a surgeon department, you cannot work there. And that's expensive. And again, gloves only when recommended. Then the forgotten chemicals. These are not chemicals you think of when you think about chemicals in a hospital, because this is not the doctor, nurse, and patient situation. This is behind the scene. And we realized some years ago that we had tons of this. And there was no routines. People just buying these chemicals everywhere. So we asked them, well, maybe you not necessarily need another chemical. Do we need all these chemicals? We realized that we had parallel products. You can have 5 kinds of glue doing the same thing. In our hospital kind of maintenance facility, they had 160 different kinds of glue. I didn't know it existed 160 different kinds of glue, but they did. So we had one girl, Johanna Buck, I don't have a photo of her, but she asked the people working there, the technicians, empty all your wardrobes with these chemicals and try to prioritize them. And she had stickers like, if you put a red one or something, you can. This is not something I'm going to use. A green one, okay, this is necessary. A yellow one is maybe in the future. And it ended up like this. They reduced the amount of chemicals by tons. But I think the success factor was to involve the people who use the chemicals. You cannot come to these technical wards and say, like a police officer, you have to involve them. They have to be involved in the discussion. And also they shared best practice and experiences. And we say this over and over again, only the chemicals necessary should be in store. Because it's expensive to have these chemicals in the wards, because you have to have updated safety data sheets, there should be risk assessments, it should be registered in our software, so they should not be there if you don't use them. And like this morning, we have this collaboration in Sweden where we harmonize our demands in procurement. And what we ended up in was like I said, we moved from chlorine to hydrogen peroxide, fragrance-free chemical products, and we want to avoid antimicrobial coating. We have had questions regarding this. This is not giving aerosols. We have checked that. But that is hydrogen peroxide instead of chlorine. So it worked. And like this morning, with this collaboration, we have moved from vinyl PVC gloves to nitrile gloves. And we always, in our procurements in the whole country, ask for PVC when it's possible. No bisphenol A. And it's especially when we procure things for small children. We use the European phase-out list. And again, if we use that, we can speak with one strong voice to the market. So try to think, what are we going to tomorrow? It's totally quiet. You're not doing nothing tomorrow. You're free tomorrow or whatever. But I think you can try to use less gloves, maybe. Tidy your chemicals or something else. I don't know if I have my rubber duck somewhere. Should be here. Do you have this kind of toys in your waiting room for children? You can try to move that. And we're actually now in Healthcare trying to develop our network. So I mean, use this opportunity to speak to somebody who has done something interesting. There's a dinner today. I don't know how many of you will attend, but I mean, take this opportunity to learn from each other, share email addresses, and maybe phone number. So, is there anyone who wants to say something what I want to do tomorrow or maybe next week? I think that's one of the ideas with having these kind of trainings is to kind of develop the network. So I don't think I want to say much more because it's late in the afternoon.
So thank you very much for the presentation. And it's also great to have some very concrete examples on reducing harmful chemicals. And I see there is a hand up there, so maybe I will go straight to that.
I'm Clarice. I'd like if are you have some experience with hypochlorous acid and the use of this acid in substitution for chemical disinfectants in hospitals here in Europe?
Well, I don't think I got the question.
Hypochlorous acid, one different kind of the product for use in hospitals or industries that it's used around the world. And I received some proposal in Brazil, because I'm from Brazil, and I received some proposal to assessment one product with hypochlorous acid. And it's one new proposal, one innovation for substitution, use chemical disinfectants in hospital, and one proposal to create one safety environment and safety patients and in healthcare systems. I would like to see if you have some experience about this substance.
We have one proposal for one company called LifeClean. It's called LifeClean, and that's chlor something. I think it's kind of similar. But we sort of, we don't need it. We have the alcohol, it works. And hydrogen peroxide. And this company that asks us, you need to have this. No. So once we don't ask for it in our procurement, then they can't offer it. So that's the way we try to stay away from these suppliers, these new chlorine-based these chemicals. Because we have our system, we have our hygiene routines, and it works. I mean, there's no use for introduce something else. And once we have managed to phase out chlorine, we should not phase it in again. So.
Thank you. And I guess it's also similar to the story of the plastic use and the single-use plastic. Again, people were not necessarily asking for it, and things were working fine in many cases. But these new innovations were appearing, and slowly we moved towards that. So I do want to offer a bit of time for discussion. And I'm sorry, I know I promised a lot of some discussion today, which did not happen in the end. Maybe some of you are happy about that. But I'm a bit sad because I did want to offer you the space to interact a bit more at your tables. But maybe I want to thank Anders for coming, for being our reusable speaker. Thank you so much.
Thank you.